This is the first study to analyze whether creatine improves cognitive function in women with menopause. The results are surprising, positive, and could change the way this supplement is used during this physiological stage of life. However, the study protocol is very different from the way we usually use creatine. That's why there's so much to discuss today. In this video, you'll learn why women benefit from creatine even more than men. How can it help during non-fertile years, and especially, how can it improve mood and cognitive function? I'm Dr. Borja Bandera, a specialist in endocrinology and nutrition, and today we're talking about creatine and menopause. Women, due to hormonal, anthropometric, and physiological differences, have up to 70% less creatine in their muscles compared to men. Do you have less muscle mass? Creatine intake from meat and fish is typically lower, and estrogens and progestogens boost creatine metabolism. In addition, these sex hormones modulate the activity of creatine kinase, the rate-limiting enzyme in its synthesis. Menopause is biologically marked by the abrupt drop in estrogen and progesterone. This has a direct and very negative impact on muscle and bone mineral density. The decrease in both parameters in turn makes you more vulnerable to sarcopenia, osteoporosis, insulin resistance, and decreased functional capacity. A similar but less sudden effect occurs in men due to declining androgens. This can improve a lot when strength training is incorporated into your routine, at least 3 times a week. And it is considerably enhanced by creatine supplementation, as these recent studies show. So creatine has long stopped being just a supplement for men or for young guys who want to get strong. If you want to know more about creatine and women, I'll leave you this video. Another area that worsens significantly during menopause is the cognitive and emotional one. It's actually the most misunderstood and mistreated part of menopause. Sometimes it's cruelly disregarded or blamed on mental health issues. I'm sorry, but that's not the case. These are fundamental biological changes, and you'll understand that now. Estrogens and progestogens are also neurosteroids that protect the brain, and when they decrease, it's easy for neurons to have a harder time managing their main fuel, glucose. This leads to a state of energy hypometabolism, working memory fails, and there's a loss of focus. Regarding mood, there's more vulnerability to depression, more irritability, more anxiety, and all of this is further intensified by sleep disturbances. And if we look for a common denominator in all these changes, we can point to one thing: irregularity. Instability and shifts in brain bioenergetics affecting how neurons in glia generate and use adenosine triphosphate. Can creatine help here? That's what the researchers of this new clinical trial tried to find out. The trial was called Concrete Menopause. Well, in this trial, 36 perimenopausal or menopausal women were studied for 8 weeks, with an average age of about 50 years. Volunteers were split into 4 groups. The first group was given a low dose of creatine hydrochloride, and when I say low, I mean very low. From 0.75 to 1.5 grams per day, AL was given a medium dose of creatine hydrochloride. Now I'll explain what creatine hydrochloride is. The third group was given a mixture of creatine hydrochloride and creatine ethyl ester, which are very rare forms of creatine. I'll explain now. The fourth group was the placebo. They measured cognitive function, especially reaction time. They wanted to see if creatine speeds up information processing and brain metabolism, especially in the frontal lobe. This is really interesting. They wanted to see if creatine reached the brain and boosted its reserves. They also measured markers like blood lipids and the severity of mood symptoms and swings. They used neurocognitive tests, fMRI, blood analysis, and clinical questionnaires. I see you, and I'm sure you want to get right to the conclusions. Have you ever wondered what creatine hydrochloride is and how it differs from other forms? Well, it's the hydrochloride creatine that you've probably seen in some brands. You might have wondered, hey, does this work? Does it not work? Alright, the creatine molecule, in this case, bound to hydrochloric acid, and supposedly this increases its solubility in water. This way, you wouldn't get that gritty texture in the glass of water. And this, along with supposedly better intestinal absorption, are the 2 main selling points. I say supposedly because there's no more evidence than for creatine monohydrated. The other form, thiol-ester creatine, has more conversion to creatinine on the other hand, and it's inferior to monohydrate. Also, I'm not sure why they use both creatine forms in the study. The evidence strongly supports the use of creatine monohydrate and not these alternative forms, which are also much more expensive. Alright, now let's move on to the main conclusions of the study. Cognitive and brain improvements were found. Supplementation with very low doses was superior to placebo in improving reaction time. And for me, this is the most surprising part. to increase creatine levels in the brain, especially in the frontal lobe, is the main finding. There was also an improvement or potential benefit, although not statistically significant, in mood. It is postulated in the trial that it could reduce the severity of mood swings. But, as I said, the difference was not statistically significant, so little can be concluded. And something good is that all forms of creatine tested, including low doses, medium doses, full ester creatine, and hydrochloride, were well tolerated, and no serious adverse effects were reported. What should you conclude from this new work? Many things, all very interesting. This is the most interesting part of the video. Stay tuned. Creatine during menopause is a useful addition to first-line interventions like sleep hygiene, strength training, and hormone replacement therapy when needed. That's right, but why? Look, creatine helps the female brain transition through its energy crisis during this delicate stage. The creatine-phosphocreatine system acts as an energy buffer and can support neurotransmission and synaptic homeostasis when glucose supply becomes less efficient. I always use the analogy that creatine is like a cellular battery that comes into play when you need it the most. We also have clinical precedents where, in depression, creatine together with a selective serotonin reuptake inhibitor, improved the clinical response. Regarding the use of antidepressants alone, that is creatine plus antidepressants, the patients did better than with antidepressants alone. It seems that even very low doses of creatine, 0.75 the lowest ones, can increase the intracerebral levels of this molecule, which for me is the most surprising finding, since it contradicts other evidence that claims higher doses of creatine are needed for it to reach the brain. The trial has many limitations, including only 39 women and combining perimenopause with menopause. The status of hormone replacement therapy, diet, physical activity, or sleep is not clear for any of them. Moreover, all these factors are modulators of cognition. Lastly, marginal creatine formulations with less evidence, such as hydrochloride and ethyl ester, are used. And I don't understand the justification for this action, but anyway, the message is yes. In light of this and other studies, it seems that creatine monohydrate is an ally during menopause. Do you have any questions? Let me know in the comments. I'll see you in the next video. A big hug, thank you for your attention, and let's keep empowering.